Welcome back to G Fun Facts Online. Today we are going to take a journey into one of the most unusual, slightly uncomfortable, yet potentially revolutionary frontiers of modern medicine. We are doing a deep dive into the science of enteral ventilation. Now, if you have seen the headlines, you might know this by its more colloquial and frankly hilarious name, which is breathing through the rectum. I know, it sounds like a playground joke. It sounds like the kind of thing you would read in a science fiction satire. But the reality is that this concept, scientifically termed enteral ventilation via anus, or EVA for short, is being hailed in the hallowed halls of top-tier research institutions as a potential game-changer for critical care medicine. This is a story that takes us from the muddy bottoms of freshwater ponds to the history of the atomic bomb, and finally, to the sterile environments of the intensive care unit in 2025. So let's skip the long introductions and get right into the science, the history, and the future of how our intestines might just save our lungs. To understand why scientists are even looking at the rectum as a respiratory organ, we have to go back to the respiratory crisis that shook the world during the COVID-19 pandemic. That period laid bare the fragility of our modern medical infrastructure. Hospitals worldwide were overwhelmed, and the primary bottleneck in saving lives was the supply of mechanical ventilators. We tend to think of ventilators as these magical machines that fix everything, but mechanical ventilation is actually a brutal intervention. It requires heavy sedation and intubation, which involves shoving a tube down the throat. But physically, the issue is that it works by positive pressure. It forces air into the lungs. Our bodies are designed for negative pressure breathing, where the diaphragm drops and air is pulled in gently. When you force air in with a machine, you risk physically damaging the lung tissue, a phenomenon known as ventilator-induced lung injury, or VILI. Furthermore, when a patient has severe acute respiratory distress syndrome, or ARDS, the lungs are sometimes so damaged, so stiff and fluid-filled, that they simply cannot exchange gas anymore, no matter how much pressure you use. In those cases, physicians are left with very few options, mostly relying on ECMO, which is a machine that takes blood out of the body to oxygenate it. It is incredibly invasive and resource-intensive. It was in this climate of desperation that Dr. Takanori Takebe, a researcher with appointments at Tokyo Medical and Dental University and Cincinnati Children's Hospital, began looking for alternatives. He decided to look away from high-tech silicon and towards the ancient history of evolution. He found his inspiration in a small, bottom-dwelling freshwater fish found in East Asia called the weather loach, or Miscurnus anglicaudatus. This fish is a master of survival. It lives in environments where oxygen levels can fluctuate wildly, often dropping to near anoxic levels that would kill most other fish. To survive, the loach evolved a superpower called intestinal respiration. When the water gets hypoxic, the loach swims to the surface, gulps air, and passes it down its digestive tract. Now usually, the stomach and intestine are for digestion, but in the loach, the posterior intestine, or the hindgut, has undergone a radical evolutionary transformation. The skin lining the gut there is incredibly thin, and the tissue is packed with a dense network of fine capillaries. This structure basically mimics the alveoli of the mammalian lung. As the air bubble passes through the fish's gut, oxygen diffuses directly across that thin gut wall into the bloodstream, and carbon dioxide diffuses out. This phenomenon is known as gut air breathing, and it is not just loaches. Certain catfish and sea cucumbers do it too. This proves that the gastrointestinal tract, which is actually embryologically derived from the same tissue as the lungs, retains a latent capacity for gas exchange. So Dr. Takebe asked the provocative question, do mammals still hold the keys to this dormant ability? Could a human being do what a loach does? To answer this, we have to look at human anatomy. We know the mammalian rectum is lined with a mucous membrane that is highly vascularized. This is actually why suppositories are such an effective delivery method for drugs. There is a rich mesh of hemorrhoidal veins there that absorbs chemicals directly into the systemic circulation, bypassing the liver. Theoretically, if the rectum can absorb large complex drug molecules, it should be able to absorb small diatomic oxygen molecules. In a groundbreaking study published in the journal Med in 2021, Dr. Takebe's team tested this on mice. They placed mice in a lethal low-oxygen environment. The control group, which had no help, perished within about 11 minutes. The team first tried to mimic the loach exactly by pumping pure oxygen gas into the rectum. They called this method GEVA, or gas ventilation. The results were mixed. The gas did not diffuse efficiently because mammals have a thick layer of mucus protecting the gut, unlike the adapted gut of the loach. To make the gas work, the researchers had to gently abrade or thin out the mucosal lining of the rectum. Once they did that, the mice survived for 50 minutes, nearly 5 times longer. However, and this is a big however, you cannot go around abrading the intestines of sick human patients. Damaging the gut lining would lead to bacterial infections, sepsis, or perforation. So gas was out. They needed a safer vehicle for the oxygen. This is where the story takes a turn into high-level chemistry and the history of the atomic age. The researchers pivoted to liquid-based enteral ventilation, or LEVA. Instead of gas, they used a liquid carrier capable of holding massive amounts of oxygen. They found the perfect candidate in a class of chemicals known as perfluorocarbons, or PFCs. Now, you might not have heard of perfluorocarbons, but their history is fascinating. These are hydrocarbons where every hydrogen atom has been replaced by a fluorine atom. The carbon-fluorine bond is one of the strongest in organic chemistry, making these molecules incredibly stable and chemically inert. They were actually first synthesized in bulk during the Manhattan Project under the codename Joe's Stuff to serve as coolants and insulators for uranium isotopes. The physics of these liquids is what makes them perfect for breathing. The fluorine atoms repel each other slightly, creating a loose liquid structure with large molecular holes where gas molecules can sit. To give you a comparison, water dissolves very little oxygen. Human blood, thanks to hemoglobin, carries about 20% oxygen by volume. The specific PFC used in these trials, perfluorodecalin, can dissolve up to 50% oxygen by volume. Furthermore, unlike hemoglobin which gets saturated, PFCs follow Henry's law. This means the more oxygen pressure you apply, the more oxygen dissolves into the liquid, linearly, without a ceiling. If you are a movie buff, you might remember the film The Abyss from 1989, where a character dives deep into the ocean breathing a pink liquid. That was based on real experiments with PFCs. Scientists in the 60s actually submerged mice in oxygenated PFCs, and the mice breathed the liquid into their lungs. However, liquid breathing for the lungs never became standard because it is physically exhausting to move dense fluid in and out of the chest. But here is the genius of the rectal approach. The gut is a muscular tube designed specifically to move solids and liquids. It handles the dense fluid with ease. So when the researchers put this oxygenated liquid into the rectums of mice and pigs, without any abrasion or damage, the animals showed remarkable resilience to hypoxia. In pig models, which are physiologically closer to humans, the procedure increased systemic oxygen levels significantly. Pigs that were pale and cold from lack of oxygen regained their pink color and warmth. The study proved mammals could breathe through their intestines if the oxygen was in the right vehicle. But as we know, the leap from animals to humans is where most medical technologies fail. This brings us to the recent history of 2024 and 2025. Following the success in animals, the team launched a phase 1 clinical trial with human volunteers. The results marked a historic milestone. They recruited 27 healthy male volunteers, aged 20 to 45. The objective was to test safety and tolerability. They administered perfluorodecalin into the rectum in escalating volumes, starting small, but going all the way up to a massive 1,500 milliliters. That is 1.5 liters of fluid. The findings were incredibly promising. First, safety was confirmed. There were no serious adverse events. Importantly, no systemic absorption of the chemical was detected in the blood. The PFC stays in the gut and is not metabolized. It just delivers the oxygen and leaves. Secondly, tolerability was surprisingly high. The volunteers were able to retain the liquid for the required 60 minutes. The side effects were mild and exactly what you would expect, mainly abdominal bloating, a sensation of fullness, and the urge to defecate, particularly at volumes over 1 liter. This trial proved that the human colon can accommodate the volumes of liquid necessary to provide a therapeutic oxygen benefit. It transformed EVA from a biological curiosity into a viable clinical candidate. So how will this be used in the real world? We are probably not going to replace mechanical ventilators entirely. Instead, enteral ventilation is poised to become a vital bridge therapy. Think about that ICU patient with damaged lungs. By supplementing oxygen through the gut, perhaps providing 10 or 20% of the body's needs, doctors could turn down the settings on the mechanical ventilator. This lung rest strategy could significantly reduce scarring and long-term damage, allowing the lungs to heal. Then there is emergency medicine. Imagine an ambulance responding to a severe asthma attack or a drowning victim. Intubation in the field is difficult and risky, but an EVA kit, which is essentially a bag of oxygenated liquid and a simple catheter, could be deployed by paramedics in seconds. It relies on gravity or a simple pump, making it incredibly low-tech. This also makes it a potential lifesaver in resource-poor settings or disaster zones where electricity and compressed oxygen are scarce. Before we conclude, we have to mention the accolades this research has received. In 2024, the research team was awarded the Ig Nobel Prize in Physiology. The Ig Nobel Prizes honor achievements that first make people laugh and then make them think. The media reaction was predictable, with headlines about butt breathing proliferating across the internet. But Dr. Takebe accepted the award with grace. He recognized that the humor drew attention to the science. The award highlighted a crucial aspect of scientific progress. Truly innovative ideas often look ridiculous at first. By looking at the undignified end of the digestive tract, the researchers found a solution that dignified respiratory science had overlooked for decades. Enteral ventilation challenges our fundamental understanding of human anatomy. It repurposes the organ designed for waste elimination into an organ of life preservation. It is a synthesis of evolutionary biology, advanced fluorocarbon chemistry, and clinical pragmatism. While we may not be aquatic creatures like the loach, this science reminds us that our bodies are adaptable, resilient, and full of untapped potential. As we move toward Phase 2 trials to prove the efficacy of oxygen delivery in humans, the medical world watches with bated breath. Anticipating the day when holding your breath might just mean letting your gut do the work. Thanks for listening to this deep dive on G Fun Facts Online. If you enjoyed this detailed look at enteral ventilation, make sure to follow us for more rigorous explorations of the world's most fascinating science.